Now we'll get to our last question for with the panel today. And so for each of you, what is something in head and neck cancer that we're making progress? And this can be based personally on your individual research or efforts made by the field in general. So Dr. Chen, I'll let you take this one first.
Thank you for the question. I think I might slightly deviate and say there are sort of two things that I'm very excited about and about this going forward with radiation treatment for head and neck cancer in general. One is, I guess, what I call precision radiation therapy, mainly using the term to outline the need to more individualized radiation treatment for every patient, and also more precisely targeting tumor with more advanced techniques, for example, with adaptive radiotherapy or proton therapy or other advanced techniques. And the other one is our ability to treat and manage post-treatment toxicity is advancing, and there are new treatment on the horizon to manage and ameliorate some of the toxicities originating from radiation and other treatments from head and neck cancer. So very excited about the field.
Wonderful. And Dr. Blumberg, what about you?
Yeah, thanks. And Dr. Chen, I'm excited about those things too. I'll pivot a little bit. One of the disease processes that's near and dear to my heart is something called anaplastic thyroid cancer, which is a extremely aggressive cancer that traditionally has a survival of about 6 months after diagnosis. And due to molecular profiling and understanding some of the driving mutations and targeted therapies, and a subset of those, we're seeing tremendous responses in patients that would have otherwise died. And so seeing that is happen in your lifetime is extremely encouraging and exciting. And the specific mutation that we're looking for is something called BRAF that's seen in other tumors like melanoma. And so one of the things that's exciting is our approach to treating those who don't have that mutation in order to try and get the best outcome for those patients that don't really have much option at this point. And so to see an actual shift in a significant shift in overall survival and treatment of a disease process in your lifetime is pretty exciting. And I look forward to what we see on the horizon for those.
Thanks, Dr. Blumberg. And Dr. Trivedi.
Yeah, so for me, I think going back to the laboratory, we are finding new pathways, new kind of alterations in cancer cells, and understanding how they've been able to kind of grow unchecked and how they can affect immune cells in patients with head and neck cancer. And so as we identify these new pathways and these new systems, we can better target them with new treatments. So that's very exciting to me that, change does come slowly, but we are getting better at both finding these pathways and targeting them with new drugs.
Perfect. Yeah. And I'll take this one too. And this is a simple one, but all of us on this panel really believe in multidisciplinary care. But for the patients who are listening to this, I think it's incumbent on all of you to seek an opinion from all of our disease specialists within head and neck cancer, because as the field is changing, there's going to be a role for each one of us. And even as we get into earlier stage disease, there are going to be studies potentially that may look at immune therapy, even in a pre-malignant lesion. And so I think this is where we as a community of specialists have to work together for each patient to help decide the best treatment plan for them. And so with that said, we've come to the end of today's roundtable discussion. I want to thank our panelists for this excellent conversation. Thank you to Cancer Grace for allowing us to join, and have a great day.